Friends, hello everyone. Today we'll do a set of exercises that will help relieve pain in the sacroiliac joint and thus take the load off the lower back. You can do the exercises together with me in real time. First, I lie down on my back and pull my knees up to my chest. My goal is to stretch the back of the thigh and the gluteal muscles. Hold for 30 seconds. Breathe. We will switch legs. The sacroiliac joint is flat and not very mobile. Since it is surrounded by strong ligaments, it hardly moves, but it does have some gliding movements. That's why it's important to unlock it from time to time and provide mobility. Again, hold for 30 seconds. Good. After this, we will pull the leg up. I throw it to the opposite side. My left leg goes to the right. The arm stays in the other direction, and we fix it in place. Hold for 20 to 30 seconds. Breathe. Good. Return to the starting position. Lower the leg. Pull the right knee to the chest and turn it to the left. If our sacroiliac joint is not very mobile, limited in its range of motion, this will provoke issues. Persistent pain in the lower back region, which may radiate down to the buttocks or legs. Good. Next, I remain in the same position. I pull my left leg up, I need to place it on top of the right, and I hold myself under the knee with both hands. My back stays on the mat, and in this way, I bring my leg closer to my chest, forming a figure 4 with my legs, and I hold this position. All stretching exercises should be done calmly with both hands, breathing, relaxing, and pulling towards yourself. Good. Switch sides. I lower my left leg, cross the right one, and wrap both hands under the knee. Now gently pull your knee in towards your chest. As you hold this position, you should start to feel a deep and steady stretch right through your gluteal muscles. It is important to always work within a range of motion that feels completely comfortable and safe for your own body. Good. To unlock this area, we need to move the pelvis relative to the lower back. For this, I will stay in this position. One leg is in front of me, the other is behind, and I will lean forward and return back. Lean forward, return back. Doing it one last time. Returning back. Change position. My right leg goes forward, bent in front of me, the left goes back. I fix myself in this position and will lean my torso forward. The pelvis stays in place during this. We make these oscillating movements. And 3 more. Last one. Good. Next, I will need a ball the most. It can be any soft object that you can squeeze with your knees. I will lie down on my back. The back is pressed down. I place the ball between my knees. And my task is first to squeeze the ball with my legs, tilt the pelvis, and lift it up a little. I lower it, relax, squeeze, and tilt the pelvis. In this way, we activate the muscles around this joint and warm it up. All right, with this same ball, I will lie on my side. I lie on my side, relax my neck, and keep my knees on the ball. My torso is in a fixed position, and I will push my knee forward and bring it back. Push it forward, sliding movements. In this joint, the movements are so minimal, and we are pushing it through. Good. It's important that my torso stays fixed and only the hips move. The spine stays in place. And back. Excellent. And I change position. The ball is between my knees and I'm still relaxed. Push forward, bring it back. Forward and back. Good afternoon. All right. And the last muscle that we absolutely need to engage is the gluteus maximus, since it surrounds this joint. So we stay in the same position on the side. Align both legs, and the task is to rotate the legs so the toes point downward and lift the heel up. Lift up, lower down. Exhale as you lift, lower down. Exhale, lower down. I'm not helping myself with my torso. I remain on my side just the same. My abs are slightly engaged. You should feel the side of your thigh and your glute. Slowly exhale. Exhale. Now, exhale slowly and completely. Good. And switch sides. Now, please take a moment to rest quietly and recover. Take a moment to rest and recover. Just breathe. Twenty repetitions will be enough. Friends, do this set twice a day. If you feel any discomfort, skip this exercise. Then remember, hip mobility is the key to a healthy back.